a new topic about the benefits of My Health Record. So what are the benefits? It facilitates information sharing between clinicians that are providing care. It can enhance clinical coordination and support care, and can enhance self-management. So if you've watched other topics in our My Health Record series, you will have seen this slide before. However, it provides an overview as to all the different types of documents contained within My Health Record and their source of input, namely healthcare providers, consumers themselves, Medicare, and other sources. So My Health Record is a great digital tool containing a range of information that can support clinicians, but you may still be wondering how it can add value and what benefit does it provide in my clinical practice. So remember that My Health Record is not designed to replace other sources of information available to you, but rather to enhance the information that is available to you. So these specifically curated pieces of documentation are put at your fingertips for ease and transparency to optimize clinical decision making. So this next video has Sue Emerson, a nurse, talk about the challenges with obtaining health information in aged care. This video just runs for about 1:30.
Older people are really surprised that the systems don't talk to each other. There's also an assumption that we can access their history, their health information, that systems do talk to each other and that we all share comfortably. That really hasn't been the case as easily as it is now with the My Health Records. We can have access to things like vaccinations. Influenza vaccine has become an incredibly important protective thing for people who are ageing and living in residential aged care and in the community. So, having that sort of immunisation record, having access to pathology, and having access not just to a list of medications that have been ordered, but to actually be able to see those that have been dispensed. It doesn't tell us if the medication has been taken, but it's another part of the picture that we can see that medication that was ordered has been dispensed, and then we can speak to the person themselves about whether they've taken it and how they're finding their medication. People are wanting to stay at home, and the My Health Record will follow them and be there in the background wherever they may go, be it relocating to another state, be it travelling on holidays, intrastate or interstate within Australia. The My Health Record goes with them. And then in those health bumps, those times when we do need to touch the public health system, perhaps with an admission to a hospital or the private health system, or day surgery, older people are going to be staying in the community longer, and this record is going to follow them and really address those concerns around, why don't you know my history?
Shame. Adding value to clinical practice. So let me highlight some clinical benefits from using the My Health Record functions. So remember, historically, information about your healthcare journey was held individually within each health service that you visited, whether this be a GP or a specialist or a pathologist. Now a key piece of your health information from each health service are now collated in one place. So remember, My Health Record is not designed to replace other sources, but to enhance the information available to you, just to reiterate. On the left-hand side of the screen here, you will note a list of some of the clinical tasks that are commonly undertaken during any given day in aged care. So it could be medication reconciliation, taking a resident's history or conducting an assessment, requesting any tests or scan, and or discussing end-of-life decisions. On the right-hand side, you will note how My Health Record can support clinical staff with sourcing information. For example, access to the medication and allergies information via the Consolidated Medicines View provides key information that can help facilitate medication reconciliation tasks. We know that this in turn plays an important role in reducing potential medication errors, and I'll explain in a moment how this is so. So during an admission, it is a requirement to gain access to a resident's medical history. For example, access to clinical data held within a shared health summary can also help facilitate completion of any assessments for aged care, saving them time having to collect the necessary information or having to rely on residents' ability to be able to recall their medical history accurately. Another time-saving measure is when a clinician requests a particular test or a scan for the resident, and you sense this may well have been completed previously, either via anecdotal information passed by family or through paper results that you have since misplaced. You can, in fact, check via the pathology diagnostic imaging view to see whether that test has already been done. So checking this function within My Health Record eliminates the need for duplication of tests, and which historically has seen a waste in resources, time, and money. When it comes to consideration for end-of-life decisions, you will note here that residents, in fact, all consumers do have the capacity to save their ACD, which is the Advanced Care Directive, to a PDF, then upload it to My Health Record that's accessible by all parties. Now stand by for another quick video by Dr. Lilia Ilina talking about the benefits of My Health Record.
When people come into aged care, they generally have very complex medical health conditions and a lot of chronic conditions. So they often required a lot of health providers to come into the care to give advice, and also they generally on a lot of medications. Their health information can be lost, can be incomplete. What the understanding of what the condition they have or medication they're taking, often not reliable, not accurate. So it's very important to able to provide a continuous care through a better access to their health information, their health record. In my practice every day, I see true benefit of My Health Record. To be able to access those information remotely and digitally is very, very helpful. Good afternoon.
Thanks, Jamie. So just to recap those benefits, so the My Health Record system can transform quality, experience and value in Australia's healthcare system through a range of important benefits, including all these listed here. So greater understanding and visibility between healthcare providers involved in the care of a person, enhanced continuity of care or in a person's health journey, improved access to medication history and visibility of medications that are prescribed, not only prescribed, but also dispensed and taken, improved access to clinical information, especially in the context of an emergency, enhanced capacity to better coordinate care and provide support for a person and their carers, and enhanced self-management.